Today we're going to talk about blood doping. What even is blood doping? Are there risks associated with blood doping? Is it even a legal practice? Let's explore. To start, we need to understand how the blood works in the body. During exercise, the muscles perform at a greater intensity than they would at rest. As exercise becomes more intense, the requirement for more ATP energy also increases. Breathing pulls oxygen into the body and becomes available to use and turn available glucose into energy, ATP, for the muscles to use. The attraction to obtain more oxygen in the blood, and therefore in the muscles, is that it will result in a greater aerobic capacity, performance, and endurance for an individual. There are multiple ways to increase the number of oxygenated red blood cells in the human body. These include blood transfusions, injections of erythropoietin, and the injection of various synthetic oxygen carriers. Let's take a look at these examples. There are two types of blood transfusions in terms of blood doping. They are autologous, which involves a transfusion of the athlete's own blood, which is drawn and then stored for future use, and homologous, where in this transfusion the athletes use the blood of someone else with the same blood type. This typically occurs when an athlete performs exercise at a high level of intensity for a substantial amount of time, and after the exercise their blood is then taken. Due to the high level of intensity and rapid breathing, the athlete's blood is now flowing with oxygenated blood cells, and when they are injected back into the athlete, the recipient's blood will now have much more additional oxygenated blood for the muscles to now use. Erythropoietin, or EPOs, is a chemical produced in the kidney. It regulates the body's production of red blood cells. Athletes using EPOs do so to encourage their body to produce more than normal amounts of oxygenated red blood cells in their body to enhance performance. Synthetic oxygen carriers are chemicals that have the ability to carry oxygen. Athletes that use synthetic oxygen carriers attempt to achieve the same performance-enhancing results of other types of blood doping, an increased oxygen level in the blood that helps muscles perform. So these are the most common types of blood doping. But are they safe? Overall, by increasing the number of red blood cells, blood doping causes the blood to thicken. This thickening forces the heart to work harder than normal to pump blood throughout the body. As a result, blood doping raises the risk of high blood pressure, blood clots, heart disease, heart attacks, and strokes. So blood doping, in summary, is the technique or techniques used to increase the number of red blood cells in the human body. There are benefits with blood doping, such as a higher aerobic capacity and performance enhancements, but they also come with negative risks such as heart attacks, high blood pressure, and strokes. So that was blood doping. I hope you enjoyed.